Hello, my name is Courtney Blankenship at Franklin University in Nursing Class 810. I have a quality improvement project on decreasing medication errors to increase patient quality of care. The techniques and tools used to conduct my analysis were individual interviews that were in person and group collaboration that was also in person. I met with a psychiatric mental health nurse practitioner as well as the risk manager of an inpatient mental health facility that works with geriatric patients in order to review potential gaps in the quality of patient care. I also attended a weekly meeting that discusses current incidents and trends in those incidents in order to find appropriate interventions. This group included nursing staff, nursing leaders, healthcare providers, the pharmacist, the risk manager, and myself. The results from my gap analysis came up with two gaps. The first gap being a gap in practice as electronic medical records were implemented but then removed due to the nurses refusing to use it properly. It is noted that electronic medical records significantly decreased medication errors in healthcare facilities per Westbrook et al. 2020. My second gap being a gap in process due to the nurses in the facility being mandated to work various units and shifts, leaving very little continuity of care. Medication errors are more likely when nurses are not familiar with the patients, the medications they take, or how they take them. For my SWOT analysis that I conducted, I found that the strengths are that the risk manager supports the project, the organization as a whole supports the project. There are large quantities of research that support needs for interventions. There is access and support of the nurse educator at the facility, and that I myself have a trusted relationship with the staff at the facility. Weaknesses are that all current data from facility are not well tracked. Cost is currently unknown, but is likely to be expensive. Limited time frame to complete the study. The data collected is in paper format only and not in an electronic format. Staff has limited knowledge in electronic medical records, leaving it more difficult to implement electronic medical records. Opportunities include increase in quality care for patients, increased staff satisfaction and retention due to the electronic medical records being all around easier for most to use. It will decrease subsequent medication errors because the leaders will see the incidents immediately and be able to curtail future problems. Increased use of technology, which in general just helps with the decrease in medication errors. Interventions support the nursing staff. Threats to the project are the timeliness and intervention approval. As I previously stated, it is likely to cost a decent amount of money, and it being a state facility, it has to go through a very long process for money to be approved for spending. There will be difficulties with adequate data collection due to everything being in a paper format versus electronic format currently. Missing data due to paper reporting, and of course, some of that data then in turn gets lost because papers get lost. Resistance from nurses, which we have in the past found this to be very true, but are finding ways to implement interventions to curtail that issue. And inadequate responses from nurses, just due to lack of time or due to their desire to not want to participate in this type of intervention. And these are the references that I used so far for this study. Thank you.